In today's video, we're going to be covering the anatomy of the female pelvis. We'll go through in all three imaging planes this time around, just so you can be able to see some of those differences as you transition from the axial orientation to the coronal orientation, and how you can start to see some of the structures a little bit better, especially if you're starting to struggle through some of the structures. Utilizing some of those alternative planes can help kind of put us in check and be able to demonstrate some of those structures a little bit easier than others. So here we go. So this is a classic CT abdomen pelvis scan with the use of contrast, but kind of as we go through, we'll just focus again on the kind of that pelvic anatomy rather than some of this abdominal anatomy. So just kind of going through, you can kind of see some of these structures, IVC, of course, in the abdominal aorta. Of course, you can see some of the bifurcations as we go down. You can see that bifurcation right there of the abdominal aorta into the right and left common iliac arteries, and then subsequently, if you follow the IVC down and look, it's about to bifurcate too. So it's a little bit more on the kind of the posterior region, but this would be the right common iliac vein and the left common iliac vein. So in comparison, the arteries are more anterior there, so you can kind of be able to see those differences and see how they correlate next to the psoas muscles there. So I think you can kind of see that breakdown of tissues and differentiations there. As we kind of continue to go down, the patients you can see kind of where the patient's bowels are, and kind of working down. The very first thing that we're actually seeing here is the uterus there. So that's all uterus, and let's just continue to follow it down. This actually posterior back here then is also uterus, and as it transitions down, so this is kind of more of the fundus, the anterior aspect of the uterus, and this would be kind of as it transitions to cervix and then to the vagina, as well as you kind of continue to go down those structures, a little bit air filled, so you can be able to see kind of the orifice there, the lumen, and when you can see that, it makes it a little bit easier to be able to say, all right, this is exactly what it is. You definitely can tell, and this is one of those slices you can definitely tell that that's the vaginal orifice, vaginal canal, versus that is the area of the rectum there. So some slices are going to be easier than others. Now what I want you to focus in on is the appearance of the bladder now. So just based on the size and appearance of this individual's uterus, it makes the compression on the bladder more evident. So you can see that contrast-filled bladder is there, and you can kind of see how it's wrapping, or the uterus is wrapping around it, if you would. So you can kind of just contour it in, see where that bladder is, bladder, and kind of gone there at that point. So you can kind of see that outer contour, one structure versus another structure. Now, as you kind of looking, female anatomy tends to be a little bit more difficult, especially in the learning phases of things, as you're kind of breaking things down. And one thing that is problematic or more difficult to be able to visualize is the ovaries. So what I'm going to do is I'm going to utilize a different imaging plane to be able to help us determine where the ovaries are. And the plane that I'm going to utilize and focus on is the coronal orientation. So basically what I'm going to do is, let's go from anterior to posterior. So here's that anterior side for this particular individual. As we continue to kind of scroll back in, you can see the loops of the bowel, you can see the position of the liver, and you can kind of see, hey, there's colon versus there's small intestine, so you can kind of see some of those differentiations here. What we're seeing here is that anterior perspective of the uterus itself. When we look back here, we actually can see kind of the position of the endometrial area, so kind of that internal portion of the uterus there. As we continue to go down, we'll actually kind of get into that endometrial area, which you can kind of see there's a little bit of a shade change there. But what you're seeing, though, nonetheless, is pay attention to the uterus and look at the branches that are coming off of the uterus. And we know that the uterine tubes are there, so that means that we got to be close to the area of the ovaries. So in that regard, right in here would be the region of the ovaries. And to help us identify that, we can just click on it And it actually generates over here exactly where that region is. So you can be able to see it in kind of that real-time differentiation, can be able to see exactly where those structures are from one side to another side. As an example, you can then see, you know, hey, all right, these other slices are really valuable to be able to pinpoint some of the anatomy, to be able to look at it, you know, kind of 360 degrees around and be able to see things, you know, from start to finish. So we haven't spent a ton of time looking at some of these alternative orientations, but you know, there's a ton of valuable information that's associated with them. So, you know, just as an example, we can kind of go through from one side to the other side. In this case, we're going to go from patient left through patient right. So we're on patient left now, channeling through the body. You can be able to see, I guess, where the ribs are, where the lungs are. You can see the area of the femur here. And as we continue to transition, where you can see the formation of the pelvis and how that correlates then with basically where we're actually located. So like I said, you know, hey, are we at the as is? Oh yeah, that's at the as is. You know, you can see where we're at here, where we're at here, where we're at here. And then that kind of all sums up, brings all those structures back together there and allows us to be able to see some of these respective areas a lot better when we start to look at things in all three planes there. Nonetheless, we're kind of like at midline right now, kind of painting through. And when we look at this patient, what you can see here is the area of the rectum itself, and basically up here it'll be transitioning to sigmoid colon, but you can see this whole entire contour now of this patient's uterus. So that's very visible there, and you can see then the structure of the bladder, where that's actually located there. You can see the region of the cervix, and then subsequently, as we would continue to transition down, we would, of course, get into the vagina as we move our way more inferior for this particular patient. So utilize the planes. The planes all help. That's why we have these additional planes. That's why we don't look at things just purely in sections, but rather we can be able to see kind of comprehensively from top to bottom. So in a nutshell, that's a rundown of some of the female anatomy that I want you to know, and really those important structures were mentioned kind of from start to finish. But if you have any other questions or curious about any of the other anatomical structures, whether we covered them in the video or we didn't cover them in the video, be sure to let me know. So thanks a lot.